Well, good morning. Technically, I guess it's still morning. I want to thank you all for joining us this morning. We witnessed a very powerful conference this morning. It outlined not only how to help identify addicts in our state who are caught up in the national opioid crisis, but also how to help prevent addiction and aid in the recovery process. I want to thank President Trump and his administration for leading on this issue by declaring a national public health emergency. Today, I want to highlight, empower, and encourage some of the great work that has been happening across the state of Iowa. Iowa has many efforts already underway, but our state will also begin new initiatives as we take strides to combat opioid abuse. First, we will increase prescriber use of the Iowa's prescription monitoring program. Right now, we have 43% of prescribers that are participating in the program, and that's less than half of prescribers in Iowa who are signed up. We'll work with the Iowa Board of Pharmacy and stakeholders to help improve participation in the program and identify ways to automatically notify not only prescribers and pharmacies when patients are exceeding reasonable doses. Modernizing the way that we use technology is critical to combating this deadly epidemic. And I think the first panel had a good discussion on the program and how they are in the RFP process looking for opportunities to update it. We'll work to expand prescriber knowledge through routine confidential reports and identify ways to have Schedule 5 prescription drugs added to the prescription monitoring program. This will capture other opioid prescriptions like codeine cough suppressants. Second, number two, we will work to reduce opioid prescribing to prevent misuse in Iowa. And this is an area where prescribers have made good progress. Our drug take-back programs are a critical way to combat overprescribing as well. So that's already an existing program that we have that is really instrumental in helping get rid of prescription drugs that are not being used. Controlled substance prescriptions are down 10% this year compared to last year. So that's a move in the right direction, but we want to continue to bring that down even further. I'd like to see licensing boards, medical schools, and stakeholders work to expand education and training to help bring prescribing down while maintaining patient access to necessary care. So again, it's a balance that we have to find. We'll also encourage adherence to the Centers for Disease Control and Prevention's opioid prescribing guidelines. Number three, we'll enhance intervention for Iowans misusing opioids and Iowans addicted to opioids. We'll do this one of the ways that we can do this is by expanding naloxone access, and this builds on last year's expansion. I believe Iowa should also explore joining 36 other states in enacting a Good Samaritan law. This law, along with immunizes other drug users from criminal prosecution if they call 911 when an overdose is occurring. Fourth, we should enhance substance use disorder treatment, particularly medication assisted treatment for opioid addicted Iowans. Currently, Iowa is participating in a multi-year grant that's administered by the Iowa Department of Public Health for medication assisted treatment focused on prescription drugs and opioid addiction in 10 of the highest needs counties in the state. I had the opportunity yesterday to visit Mercy Turning Point Treatment Center in Dubuque, and I had the opportunity to see firsthand the positive impact that evidence-based treatment has. Iowa Medicaid, public health, local medical professionals, and stakeholders should utilize evidence-based practices from this grant to improve medication assisted treatment in underserved counties where opioid prevalence is high. They should work creatively with our federal guidelines to expand methadone treatment access, again, especially in rural Iowa. Finally, we should work to reduce barriers to Medicaid-assisted medication-assisted treatment drugs by working collaboratively to improve access for Iowans needing these evidence-based treatments. Iowa has taken a multifaceted approach to combating the opioid epidemic, and we know that we need to do more. So these proposals will produce transformational results, and I look forward to working with stakeholders and the legislature next session as we work to identify, prevent, and recover through the national opioid epidemic crisis. And at this point, I'd like to turn it over to Attorney General Tom Miller. This has been something that Attorney General Miller has worked extensively on, and I look forward to working with him as we move forward in this process.
Thank you, Governor, and thank you, Governor, and everybody for this morning's program. It was, I think, a very good program, a very constructive discussion. But I'll say quickly and hopefully clearly what I said in the conference, that, you know, I'm a lawyer. I love math and statistics and complicated situations and solutions. But here, it's just so simple for me anyway. That 20 years ago, opioids in America and Iowa were used in this way. They were used in a very limited way. They were used as a pain remedy of last resort, very last resort. They were used with a great deal of caution and respect because of the addictive nature of opioids. They were also used in end-of-life situations, and that's an appropriate place for opioids. And then about 6 years later, largely through the influence of the pharmaceutical companies, it all changed to a situation where opioids were one of a series of products, a series of options for pain. They weren't treated with caution or respect. The addictive nature of it was downplayed and not calculated into prescriptions. And what has happened is awful. The Washington Post estimates that 200,000 Americans died since 2000 as a result of this. So my appeal to all Iowans, particularly the medical community, but patients and government and everybody that's involved in this, is first and foremost, let's go back to where we were 20 years ago, that we should only use opioids in very limited circumstances where nothing else works. We should use them with a lot of caution. And respect and concern about addiction. A friend of mine recently had a horse riding accident and broke some ribs, which is a painful injury. She got treated, and she took herself off opioids after 20 days. Her doctor wanted to give her a prescription for 30 days. I think there is growing evidence that in the 14 to 21 days of use of opioids in a regular prescription is a real danger point for many people in addiction. But 30 days, what planet has that doctor been living in? We really have to address this problem and address it dramatically because so much is at stake. And the ultimate solution is relatively basic. So whenever I talk about opioids, I make that pitch because I believe so strongly. And I thank all the medical professionals and everybody else that's been working in this area. It's not easy. It's very challenging, but it's extremely important. You know, think about it. Someone goes in for dental work, broken ribs. They're given a prescription for 30 days. And somewhere along the line, they become addicted. They go through the horrors of addiction, the treatment, the family dynamics that can be awful difficult. Some of them die. That should not happen and wasn't happening 20 years ago. I talked to a couple doctors the other day, and one of them said to me, Tom, do you think there was less pain 20 years ago? And I said, no, I don't think so. And he said, of course not. That tells the story. Thanks.
Thank you, Governor, and thank you, Mr. Attorney General. Good morning. As Governor said, we want to thank the President for declaring the opioid crisis a public health emergency today. It's very fitting that we're gathering here today to address the situation in Iowa. I wish we could say we were that good at planning and had everything lined up perfectly, but we actually chose this week months ago because in 2 days, on Saturday, October 28th, it is Prescription Drug Take-Back Day in the state of Iowa. This year, there will be drop-off opportunities in all of Iowa's 99 counties, and we hope that everyone will take advantage of that. Pain medicines are the most common type of controlled prescription drug dispensed in Iowa, and the #1 reason for exposure calls to the Iowa Poison Control Center. Federal studies have shown that over 70% of those who abuse prescription medicines obtain the drugs from family and friends. By properly disposing unused medicines in a timely manner, Iowans can help prevent the diversion and abuse of those drugs. So make no mistake, that's a very simple action, but it saves lives. Prescription drugs can work medical wonders when they're used for their intended purpose, but they become a threat to safety and health when they're misused and mishandled. So we encourage all Iowans to participate in the National Prescription Drug Take-Back Day on Saturday. But if you can't make it this Saturday, we encourage you to visit one of the many permanent year-round take-back sites in Iowa. Well, Governor and I visited a pharmacy when we were doing some Main Street visits in the small town of Bedford, Iowa in Taylor County, and had very glowing responses from the pharmacists who said you couldn't believe how much people were using that and how great it was that they were using that as an opportunity to properly dispose of their prescription medications. So for a list of the participating sites all across the state, please visit the Office of Drug Control Policy's website. And I just want to say thank you for being here and thanks for your attention to this issue.
We'd open it up for questions on this issue.
Doctors have resisted the idea of limits on prescribing, and it seems as if you're going to not endorse that idea.
Well, no, that's not what I said. Okay, it's about finding balance. That's the point I need to make. So let's take a look at it. Technology plays a critical role in that as well, especially when you're looking at long-term diagnosis, cancer treatment, rural Iowa access issues, and giving them somewhat flexibility in prescribing medications. But I think we need to also, as Attorney General Miller said, look at the number that they're prescribing. So I think there's an opportunity to find balance in that, and especially technology will go a long way, I think, in helping us really find and address the balance.
Governor, are you in favor of mandating that doctors check the PMP at least in certain situations and mandating that they limit prescriptions to 7 days for acute pain?
You know, we'll work with the legislature through that process, but right now I think I agree with the PDM. There's an opportunity by making it easy, by making it part of the process to really encourage and enhance more providers and prescribers to get on the system. So I think there's an opportunity for us to encourage that, maybe without a mandate initially, and then if we're not getting where we need to get, maybe then take a look at it. But I think there's opportunities there. You heard some concerns about the system and that the technology was antiquated. And so, you know, we need to simplify the process. We need to make it, I think I heard this morning, part of their routine. So that's just normal practice. And I think the easier we make it and the more that we can simplify it, you're going to naturally see more participation. There were a couple other good suggestions from the second panel on how we can utilize it. Some of the treatment centers, they talked about how they're able to use the system to really help better provide the accurate treatment for the individuals that they were working on. So that's some of the discussion, though, that we're going to continue to have. I mean, that's why we're doing 2 or 3 other stops to continue to get feedback and make sure that we're asking all stakeholders that same question, and then we'll look forward. But we do need to increase the number. We're under half. We're only at 43%, so we need to do what we can to increase the number participating.
Governor, as someone who's had an open panel against addiction,
Yep.
people at home are watching the coverage of this and they're going through that. What advice would you give them about being successful?
Well, I hope they had a chance to hear Caleb's story. So I think what courage Caleb had to stand up and talk about the horrors of addiction and how he never anticipated finding himself in that situation. And I think that's where a lot of us find ourselves. It's in addiction. And so that there are opportunities to turn your life around and to find a better life. And it's really important that when an individual understands that they want to get healthy, they want to get better when they're at that point in the addictive process, that they have access to a support system that can really help them through a very difficult journey. And so the courage that it took for him to stand up and to tell his story and to talk about how good life is today and that he has a job and he has a girlfriend and he's excited about tomorrow. I think that's a testament that you can turn your life around and things can get better. But it's important that we also, as a community, are working together to provide that support system that Iowans need to get healthy.
Governor, what do you say to people who say that the declaration that this is a public emergency, Trump administration doesn't go far enough because mainly there's going to be no new allocated funds to help combat this crisis across the country?
Well, I think they're still working through that, but let's just not go there. Let's collectively look for ways that we can work together to, first of all, identify the great things that are happening, empower those that are doing good work, like the facility Mercy Turning Point that I visited yesterday in Dubuque. They are doing phenomenal things. And that through grant programs and federal dollars and state dollars, we're going to continue to coordinate the funding so that we're utilizing it in the best possible manner. Identifying best practices so we can build capacity across the state of Iowa within our communities. I heard over and over yesterday how important it was to really have all stakeholders in the community involved and how important it is from city to county to state to federal levels of government all working together and coordinating the process as we move forward. So it potentially could down the road, it might be a little bit early yet to know if there's additional funding or not, but we do have access to some grant programming already. They talked about 2 or 3 different grant programs that the public health has been able to utilize, and especially some of the high need counties that are really had some significant usage problems.
You asked about funding and you specified grant money and federal dollars, but does this require some additional state dollars next legislative session?
Well, we'll just have to look and see what that looks like. We're just getting started. I'm trying to better understand the programs that are already taking place. The grant programs, some of them are expiring, some of them are 2 and 3 year programs. So we need to look at what they're being able to accomplish with that. And what that does is that it allows us to really take that foundation and then build capacity from that. So that's really what they're designed to do. So that's something that we'll have to take a look at. Today I can't tell you what that amount would be or what the need is, but there's already significant funding, I think, in the Department of Public Health through a lot of the programs that they are already implementing. So we just need to coordinate that and work together with federal programs.
So is the infrastructure there, are there sufficient programs available now? If somebody has a problem right now with opioids, can Iowa accommodate everybody just going in right now and getting help?
Well, no, I doubt that very much. And so we need to, first of all, that's why, Bill, it's really important that we continue. We talk a lot about prevention. That's a big piece of this as well. Working to educate parents and students and communities, prescribers, physicians, collectively working together to identify what potential addiction looks like and doing what we can through the prescription drug monitoring. I talked about expanding access to naloxone, the medication assistant treatment. Caleb talked about how that was really instrumental in him getting stabilized and turning his life around. And he talked about when he went in, it was at 12 milligrams and he's down to a half now, but it really had a tremendous impact on his ability to stabilize his life and to get it turned around and back on track. So we need to look at all of those programs and see where it makes sense to expand or, where the gaps are. I think that's one of the other areas that we can help identify as we are doing, visiting the different sites today and continue the conversation. But, as I tried to say this morning, there are a lot of positive things already taking place with the various agencies and just the stakeholders in the communities collectively working together to try to get in front of this so we don't end up like a New Hampshire or Ohio. One death is too many deaths. And so we need to just continue to do what we can. Go ahead, Kate, that's
Why do
okay.
you think this, the the pharmacy registration program or whatever it's called. It's
The
9 years-
prescription drug monitoring.
It's 9 years old.
Yeah.
Why, and you're only at 43%. Does something have to happen or?
Well, what I understand from the meeting today, and so that's again. Well, here, do you want to talk about that?
Well, I
Okay.
would just add a few comments, I
Okay.
think, on that we have slowly over time, every year we are adding prescribers. I think what's also important too is more and more medical colleges and in the training and our Board of Medicine has taken this issue very seriously. They've continued to add continuing education credits that are mandated for doctors. They are encouraging more and more use. So I think it's getting better. But you heard some of the complaints today, things like the alert function. Our hope is once the program is upgraded and, innovations are made, I think we will see more doctors using it. And I think more and more, there's a growing sense of urgency in the medical community to grab onto this tool and to use it. We did hear some criticism of the alert functions, but, we've been big fans of that in our office. I think that's a really helpful tool. So, we just want to make it more useful and user-friendly.
Yeah, that user-friendly, I think. Some of them, I think they indicated it was cumbersome. And so, they're busy and so we just need to streamline the process and make it easier for them to utilize the system. But I believe that's their intent and that's what they're working on. So they recognize that.
Do you have a deadline if that percentage doesn't go up by a certain period where it does require that there be a requirement? Because there are, I believe, at least 30 states that do require to some capacity that prescribers are in this program. So it's not new.
Yeah.
That to force prescribers to
Right.
do that. So
Right.
what's that deadline for you as to action?
Oh, I don't know. I mean, we just need to see some progress. And I think I need to somewhat wait. They're in the RFP process right now. So there's a process that they have to go through in order to upgrade the technology and simplify the program. So I think that ends the end of November, December is the time frame that they had indicated at the meeting. So let's get that established and take a look at it. And we'll have to work with the legislature. So we need to have the discussions with the legislature and kind of see where they're at. But I think once we get the new system up and going and continue to raise awareness about the opportunities and how important it is for them to participate, down the road, then we can take a look. I don't know if I need a set date. We should continually be reviewing the process and looking for ways that we can make it better. And so that would be just part of that continual review process.
These discussions are very important, but what are some of the things we're going to look at to track if this program is successful? We're talking tests, your prescription medications, what are some of the things that you're going to look at over the next year or 5 years with this issue?
Yeah, well, I think all of the above. And Steve, do you want to
Well,
talk? But it's all of the above. I mean, we're going to continually monitor every one of those is somewhat, we're moving towards success, but
But are we talking 20% down, 10% down, numbers
Well-
that have
well,
something
I-
tangible?
Thing I would just like to add is, this is definitely a growing problem here in Iowa. We are, we're lucky in many ways. A ranking came out last year by Wallet Hub that showed that we were the lowest youth usage drug rate in the country. So we have some things going right in Iowa. What I think we're mainly concerned about is not only the prescription drug threat, which is big, but the illicit drugs. We do know that there is pressing problems with heroin. There are obviously, cartel activity, gang activity, trying to push more into Iowa. There's a linkage there. So there's a lot of efforts underway. And as far as success and, what are the numbers we're looking for, obviously we do want fewer deaths. We've maintained well below the national average, but that doesn't mean we're just going to, relax. We have law enforcement working very hard on that front. The medical community is working very hard on that front. We just want to see significant progress. And I think if everybody continues to work together, we're going to get there. It's just going to take time.
Attorney General Miller, you sued the tobacco companies because of the cost the state for treating lung cancer. Isn't the state bearing the cost helping people with substance abuse? Is it time for attorneys general around the country to sue the pharmaceutical industry over this?
Kate, this is the first time that I've been ahead of you. We're working on that and have been for some time. We've been investigating Purdue Pharma in the Iowa Attorney General's office for over a year. There's been a series of multi-states formed by the states. Over 50 states are in the one multi-state or another. We are playing a leadership role in one of the investigations, and that's TIVA. Illinois and Iowa are leading that. There's been a series of meetings recently with the industry in Chicago, so that all those series of issues are very much in play, and very much at the forefront of AGs. And I will relish this day that I was ahead of you.
You have
Can I
time for
ask
one more
you-
question?
Yeah, can I ask you a question not related to this? As you're aware, there's been a huge amount of publicity nationally, news stories about the case of Harvey Weinstein, and then many other women have recounted stories of sexual harassment. Can you tell us, have you ever been a victim of sexual harassment? And what would you tell Iowa women who experience sexual harassment?
Well, I think I've been pretty clear on this. First of all, it's unacceptable, and regardless of gender, sexual harassment is unacceptable. It's intolerable, untolerated. We have a zero tolerance policy in our administration, and it sadly it happens, and it shouldn't, and it shouldn't be happening.
Experienced?
No, not really. But that doesn't say that I don't acknowledge that it doesn't happen, and it doesn't happen it happens way more frequently than it should, and it's not acceptable, and it needs to stop. And if they are being sexually harassed, hopefully this will help them come forward and talk about that. So thank you.
Thank you.
Thanks, Governor.